President Donald Trump will spend a few days at a military hospital after contracting COVID-19, the White House said Friday. Trump left the White House by military helicopter for Walter Reed National Military Medical Center Friday afternoon. A White House official said the visit was precautionary and that Trump would work from the hospital's presidential suite, which is equipped to allow him to continue his official duties. Earlier Friday, the White House said Trump, who is 74, remains fatigued and had been injected with an experimental antibody cocktail for the virus. COVID-19 has killed more than 205,000 Americans in the past 7 months. President Trump remains in good spirits, has mild symptoms, and has been working throughout the day, said Trump's press secretary Kayleigh McEnany, according to a White House press pool report. Out of an abundance of caution, and at the recommendation of his physician and medical experts, the president will be working from the presidential offices at Walter Reed for the next few days. President Trump appreciates the outpouring of support for both he and the First Lady. Physicians at Walter Reed typically handle medical appointments and other responsibilities for the president and other government leaders. White House officials emphasized that there has been no decision to have Trump step aside from any of his normal duties and have Vice President Mike Pence assume executive branch authority. The president's physician said in a memo late Friday that Trump received a dose of an experimental antibody cocktail by Regeneron that is in clinical trials. Navy Commander Dr. Sean Conley said Trump remains fatigued but in good spirits and that a team of experts was evaluating both the president and First Lady in regard to next steps. First Lady Melania Trump, who is 50, has a mild cough and headache, Conley reported, and the remainder of the first family, including the Trump's son Barron, who lives at the White House, tested negative. Military officials Friday morning downplayed worries after Trump announced overnight that he had tested positive for coronavirus. At the time, it was said that Trump would be forced into medical quarantine for an undetermined period of time. In a statement, the Joint Chiefs of Staff said they have not made any adjustments to force posture or operations as a result of the president's diagnosis. Trump tweeted just after midnight on Friday that both he and the First Lady had tested positive and would begin their recovery process immediately. There's been no change to our alert levels, the statement said. The U.S. military stands ready to defend our country and its citizens. There's no change to the readiness or capability of our armed forces. Pentagon spokesman Jonathan Hoffman said Friday morning that the U.S. military stands ready to defend our country and interests. There's no change to the readiness or capability of our armed forces. Our national command and control structure is in no way affected by this announcement. On Friday afternoon, after news of Trump's transfer to Walter Reed, he said the president's hospitalization would not change the Pentagon's readiness or alert status. Defense Secretary Mark Esper, who is currently on an official visit to Morocco, last saw Trump on Sunday at a Gold Star Families event also attended by Army General Mark Milley, chairman of the Joint Chiefs of Staff, Hoffman said. In preparation for and as part of his international travel, Secretary Esper tested negative for COVID on Monday and Wednesday of this week, Hoffman said. Today he will be tested again as planned for continuation of his travel. He will not be returning to the U.S. early. The chairman was tested this morning and was negative. Air Force Secretary Barbara Barrett and Chief of Staff General Charles C.Q. Brown, as well as Chief of Space Operations General J. Raymond also attended the event for Gold Star Families, said Air Force spokeswoman Lieutenant Colonel Melinda Singleton on Friday. All have tested negative for coronavirus twice over the past week, including before the event and as recently as Friday, and have exhibited no COVID symptoms. The Gold Star Families event also is where Marine Corps Commandant General David Berger last interacted with the president. Berger has tested negative several times during the past week, Major Eric Flanagan, a spokesman for the commandant, told Marine Corps Times in a Friday email. Marines supporting the president as part of Marine Corps Helicopter Squadron 1 will be tested for COVID-19, and following the Centers for Disease Control and Prevention guidance will go into quarantine while awaiting the results, a Marine Corps official confirmed. The Marines from Marine Corps Helicopter Squadron 1, also known as HMX-1, are tasked with providing helicopter transport to the President and Vice President, inevitably putting them in close contact with the President. HMX-1's top priority is mission readiness and the health of its passengers and personnel, Captain Joseph Butterfield, a spokesman for Headquarters Marine Corps, said in a Friday email. Retired Army General Joseph Buttle, who commanded both U.S. Central Command and U.S. Special Operations Command, told Military Times that no changes in how the military operates in this situation are likely. There is a well-established chain of command that goes through the SecDef, he wrote in an email. The Constitution provides for continuity in the case that the President is incapacitated, which it appears is not the situation at this point. I can't imagine anything in particular is going on in this regard. Contingency planning. Our military leadership is very resilient, as is our national security decision-making process.